Welcome to the Social Impact Journal, the podcast where we talk to change makers driving social impact around the world. I'm your host, Jack Farren, and this podcast is produced in collaboration with Rural Inclusion. UNESCO estimates that approximately half of school-aged girls do not have access to sanitary products. The challenges faced in Kenya are more significant, with 65% of girls struggling to afford basic products. In episode 4, I talk with Catherine Wanjoya, founder and CEO of Genesis Care, about her innovations, including sanitary pad dispensers and incinerators, and how partnerships with organisations such as UNFPA, NGOs and community agencies have kept thousands of girls in Kenya in school. This is the Social Impact Journal, and I am your host, Jack Farren. You can find us on Spotify, Apple Music, YouTube, or wherever you listen to your podcasts. Welcome everybody to another episode of the Social Impact Journal, and today I'm here with Catherine. Catherine, how are you today?
Good afternoon. I'm fine this afternoon. Thank you for having me.
It's good to have you on the podcast. Maybe you can give a brief introduction to yourself and the work that you're currently doing.
Yes, my name is Catherine Wanjoya. I'm the co-founder and CEO of Genesis Care Ventures. I am a social entrepreneur with a passion in innovating products that tackle social and economic challenges. And these are mostly for vulnerable communities in Kenya and beyond. And we do this by having our solution, which it does end-to-end menstrual hygiene solutions. And it is we have dispensers, we have incinerators, which we offer for that purpose. Thank you.
Thank you, Catherine. So for the audience, me and Catherine met at a conference in Ethiopia back in October with the Royal Academy of Engineering. And I found the work of Catherine so fascinating. So maybe before we get into talking about Genesis Care and the impact that you are creating with communities in Kenya, I would like to first understand how your social entrepreneurship journey started. What was your first ever job and what did you learn from that?
My first job actually was not on social entrepreneurship. The first job I got was soon after high school, and this was a sales job. And I was selling advertising space for a magazine owned by Kenya National Chamber of Commerce and Industry. And what is interesting about this first job that I did is that we were only paid on commission. It was 100% commission. So as you may guess, it was not very easy, especially for a village girl who had just come to the city. So that was the first job I ever did. What I learned from that job, I learned quite a lot apart from being able now to go to the streets and get to where the customers are. It was also a big challenge for that. But later I learned how to go about that. And I learned sales. I didn't have any prior training on sales, but I was able to do that. I remember after working for 2 months, I was not able to make any sales. And I actually got a warning letter. But by God's grace, the third month, I was able to sell. And I actually ended up working here for 7 years, which means I really had to be creative and be resilient because it was not easy. And especially that I was working with my peers who had already been doing it for a long time. But at the end of it, I learned things, especially the selling bit of it has really helped me even in the business that I do today. So I'm grateful for that first job, even though it was not very easy to do.
For sure. So what was your sales tactic? Were you on the phone? Were you going out to meet people and sell the magazine?
Yes, I was selling advertising space. So what it entailed is getting companies which had a budget for advertising and approaching them, convincing them to take space in our magazine. And that way, that is what the job entailed.
Incredible. And where did you see the most success? Which industries in Kenya were were you having the most success with selling the advertising space?
These were the companies which had new products coming into the market, and especially the multinationals. Those were the ones which had big budgets, and also it was not very easy to get to this because having just joined, others had already approached them. So I focused on the middle-sized enterprises, and that's how I started.
Great. So after this, in 2018, you set up Genesis Care. Was this the first journey into social entrepreneurship? Was this the first company that you founded, or did you have any other ventures beforehand?
Yes, before 2016, because that is when I started thinking about doing what I'm doing today, social enterprise. I had another business which was supplying relief goods to East and Central Africa. This is for NGOs. As you may know, we have very many countries which around us which have been having civil war, and most of the women and girls get displaced, and they move to countries like Kenya. We have refugee camps here. And that is how I started, just by supplying relief goods to Somalia, to Sudan, and also the Kenyan camps. So that was the first job. But for the social enterprise, it wasn't supposed to be a business. It just happened in 2016, after working for a long time, about 25 years. I just happened to spend a week in the village where I grew up. This is Makueni village. I then noted that the shops were not even stocking any menstrual products. The reason was because the supplies were very far from the shops. It had to take like half a day to get to the wholesalers. And this was, the transport was only by doggies. So what happened, it used to happen then was the shopkeepers used to prefer picking the products which are fast moving, and the girls and women were left with nothing to use. So I found them using still the same pieces of old clothing that I was using. And this is what made me to start this enterprise. So how I started, I just went to my village. I went to the school which I attended and donated sanitary pads. But when I came back to Nairobi, I found that it was not sustainable. So I had to be creative and come up with a product. And that is how we came up with a sanitary pad coin-enabled dispenser.
So one of the key challenges that you were looking to solve is actually the distribution of sanitary pads into remote villages or into communities that often don't have access. So you talk about a dispenser. Maybe you can go into further detail about this. So are you installing those dispensers into schools, as you mentioned, and into village areas?
Yes, when I started, the problem I wanted to solve was, one was access, and number two, affordability. Because even with the sanitary pads in packets getting to the village shops, women and girls may not be able to afford them because most of those families are poor. So the dispenser was to break that pack and sell single sanitary pads, which will make girls at least buy and be able to go to school. So when we started with a sanitary pad dispenser, I started by donating a dispenser in the school, which I attended, and I attached it to needy students, just for them to be able to get something out of it. So I could supply the sanitary pads, and then the profit, we were sharing the profit with the girl. But later I found out the problem was bigger. That's how now when we moved to schools to supply the dispensers to those schools. And again, when we moved to those schools, we found there was another big problem of disposing of the menstrual waste. And we were able to come up with a menstrual incinerator, which today we have supplied to almost 18 counties in Kenya. In Kenya, we have about 47 counties, so we are still growing. We've so far done units of dispensers and incinerators, about 78 of them. and we're looking into growing further within the year.
So what would be the cost of one sanitary pad within the dispenser?
One sanitary pad with a dispenser would be like 0.06 of a pound for a sanitary pad, which has been dispensed. Whereby when you buy a packet goes for about 1.5 pounds. So,
Understood.
and sometimes that is quite a lot for a family, especially in the slums or even in the rural areas where they live under $2.
Absolutely, absolutely. So how many sanitary pads can fit in a dispenser, and how are you actually distributing the pads to be installed into the dispenser?
We partner with the NGOs, or we partner with the other private companies or even the schools. And then when we send the dispensers there, the dispensers capacity is about 25 sanitary pads. And this brings in the need for restocking of them. And that is how now we use those beneficiaries to be able to restock those sanitary pads into the dispenser. And we share the revenue with them. So that's how we work with them. We partner with NGOs, we partner with the private companies, and we also partner with schools just to enable them get those sanitary pads there and give access.
Understood. And how can someone pay for a pad? Is it a coin-enabled dispenser, or do you have any other solutions?
Yeah, we started with a coin-enabled dispenser, but later we decided to use technology for that because we saw the need, because there are some places where they did not want to use the coins. We have a dispenser which uses mobile money for dispensing. So one just has to go to their mobile phones, go to the mobile wallet, and buy for a certain number of sanitary pads. This innovation actually came in during COVID time. This is the time people did not want to touch anything. So we moved them from the coin dispenser to the mobile-enabled dispenser, whereby after paying, the sanitary pad dispenser will just dispense the sanitary pads, and they're just able to pick them. Apart from that, we also have a dispenser we call accountability. This one, we're working a lot with NGOs who need to track their donated sanitary pads. So we are able to use IoT technology to make sure that those sanitary pads end to beneficiaries. Because we give unique pins to the users, and they use those pins to dispense. And we are also able to allocate them the number of certain sanitary pads for a specified period. So it does allocation is done. We are able even to track them and to make sure that they don't get sanitary pads which have expired. Because when the donor donates the sanitary pads, we get to register the expiry date. So we are able to help these girls access those sanitary pads, and also women, and also track those donated sanitary pads using our technology.
Incredible. I think that the use of technology and data management is so important for those NGOs to ensure that what they have donated is actually is serving its intended purpose. I understand that during the pandemic, you received some funding from the Royal Academy of Engineering to develop a new project. Was that around the use of mobile money, or was it for something else?
Actually, this was on the incinerator. As I mentioned earlier, we have menstrual incinerators. So what happened was this, as you know, things were quite tough in Kenya, and I believe globally. We were required to wear masks in public. These masks did not come cheap. One mask in Kenya used to go for about $5. And this is a time many had lost their jobs. And even in the rural areas, the casual jobs and in the slums were very rare. So one day in the evening, as I was watching the television, they featured a man who had collected, washed, and dried used masks from a health clinic, and he was selling them to unsuspecting people. And knowing the danger, this got me thinking, and we decided to see how we could solve that problem, because previously we knew our incinerators could incinerate menstrual waste. So we pivoted our incinerators to be able to not only incinerate mats, but also do light PPEs like the gloves. And these were installed in isolation centers, which actually by then we are growing. We're growing by the numbers because of the seriousness of the COVID-19 pandemic, especially in 2020.
Okay, thank you, Catherine. So how many girls are you currently serving with the dispensers?
With dispensers, we've been able to dispense over 15,000 sanitary pads. These are the ones we've been able to use technology to count, because sometimes we give the dispensers and we are not the ones who supply the sanitary pads. So I would say that the impact has been huge, especially when we started using technology, because with technology we are able to track them. The incinerators are the ones we have a big impact on, because whereas we give the sizes of the dispensers are determined by the number of users. And so far, we've been able to incinerate over 1.5 million sanitary pads in schools, rural schools, in the slums, and in markets.
Incredible! Wow! So you've been going for 5 years now, and you've been able to achieve those numbers and great impact. But I like to talk to social entrepreneurs about some of the biggest challenges that they have been able to overcome in their journey. So what would be that one big challenge that you were able to overcome?
The biggest challenge we were able to overcome was one, funding, especially for startup, is usually a big problem. But we were able to get help from people like organizations like Royal Academy of Engineering, and even the Kenya government, because when they saw what we were doing and the impact we had, we were able to get some grants. So we've gotten a lot of help from charitable organizations and also the government agencies for us to be able to do that. Another challenge I would say I had as a social entrepreneur is that you may know these products are engineering products, and I'm not an engineer. But through the networks which I developed as I went about in this organization, especially Royal Academy of Engineering, when they took us for the training in the UK, I was able to be advised that I can work with engineers to be able to come up with these innovative products. So from then, we've been working with working with these engineers who have been able to make us innovate these products.
Great. I think you've seen a challenge, in your rural village, and seeing how you can actually use technology and a great partner such as the Royal Academy of Engineering to create that solution. So you mentioned that you traveled to the UK for a workshop with the Royal Academy, and also we met at a conference in Ethiopia. So your work with Genesis Care has clearly given you the opportunity to travel to lots of interesting places. But what's the most interesting country that you've had the opportunity to visit during your career, and why?
Yes, I would say especially when we were starting, Norway, Oslo was the most interesting place that I ever visited. I got the opportunity to attend Norway Innovation Week in 2019. And the networks that I got are still networks I use up to today. So for me, that was a big benefit for our company, because we've benefited from those.
Excellent. We had someone on the podcast earlier in the series who actually said that Nairobi was their favorite place that they had the opportunity to visit. But Norway, Oslo, that's a new one for the series. So looking ahead to this year now, after all the successes of the previous year, what are your key goals for 2023?
2023, we have two goals. One is in product development. We've been able to further develop the dispensers and the incinerators. And yet we felt that the impact was not big enough. We needed to do something about the sanitary part, because this sanitary pad, we've been getting it previously from, we've been importing that sanitary pad. And now we're looking into making sanitary pads using agricultural products. And these, we were able to meet during the Royal Academy of Engineering Frontiers in Ethiopia. A group of ladies, there's a lady called Rima and also Paroma, and together with this is the London School of Economics, and those together with the Meru University, we are doing research to find out how we can make this product more affordable and more, even also more biodegradable. So that is what we are doing right now. Apart from product development, which we are doing, we are looking into scaling to more counties in Kenya. So we've targeted 4 counties in Kenya, which we want to cover within this year, 2023. And with this, we will have almost doubled the number of our products in the market. So that is the plan for this year.
So working with the London School of Economics is going to help you research along with Meru University in Kenya to see how the product development of pads can actually be made in Kenya using agricultural products. Do you know at this stage, if that's possible, how the costs can reduce for girls buying pads?
Yeah, we don't know, because we've just started like this month, because we are trying different types of agricultural waste to see which one will be able to give us a good product and also reduce the cost of the sanitary pad. So we're still researching on the same.
Understood. Okay, well that's great, and I wish you the best of luck in 2023 with product developments and also scaling into new counties in Kenya. One question that I ask at the end of each episode to every guest is that if they had a social impact journal and they had one page to share advice with a young social entrepreneur or a change maker, and in this case, a young person in Kenya who is thinking of starting in their journey to be a social entrepreneur, what one piece of advice would you give to them?
Yes, I would tell them that it's not an easy journey, and there are many challenges, but it is actually doable. They need to have a passion for what they are going to do. And also I would tell them, because change makers are known to be inquisitive, open-minded, and also to be resourceful. Sometimes one has to be creative and do something which has not been done before. So I would urge them to have the courage to try new things and do things differently, just to try and see how they can solve that social problem they're trying to solve.
Thank you, Catherine, for some very wise advice to share with a young change maker. And I think that brings us to the end of this episode, and it's been great to talk to you and learn more about Genesis Care. I'll share your social media handles and links so that those that want to find out more about Genesis can do. And I think we can wrap it up for today. Catch us next week, every Thursday, on the Social Impact Journal as we talk to founders, innovators, and academics driving social change around the world. Thank you, Catherine. Thank you, Catherine, for joining us.
Thank you, Jack, for having me.